The eligibility benchmark for financial aid from ComCare, a social safety net for low-income households here in Singapore, will be raised from Monday. The Social and Family Development Ministry will also do away with the use of total household income. A per capita household income will determine eligibility.
91-year-old Lim Heng Lee kicks off each day by reading the newspaper. He then leaves his rental flat in Ghim Moh and heads for the active aging centre downstairs. Mr. Lim, who lives with an 84-year-old brother, says he enjoys these activities because they don't cost much. And given the rising cost of living, it's becoming more important to save where he can.
我早餐在家里吃面包，就省了一些钱。晚餐我是自己出卖吃，也是比较便宜了。只是中午或者有时候要喝水、买东西这样，都要花钱这样。
But from Monday, he could afford to spend a little more if he applies for one of the 3 ComCare assistance schemes. He'll be eligible based on the per capita household income benchmark of $800 or less. That's $150 higher than the current threshold. MSF says the use of per capita household income more accurately reflects basic living expenses, which vary according to household size. The move is welcomed by community-based agencies.
They already struggle on a day-to-day basis of putting maybe getting free meals or paying their bills fully. And now I think with inflation, I guess the amount of debts that are being chalked up will be much faster.
But income alone will not automatically qualify someone for the scheme. MSF says a holistic assessment will be made by social service officers who will also consider factors such as savings level and availability of family support.
We are now able to consider a lot more factors such as the medical condition, their mental health, how it affects their ability to work, and how much work can they take in. And therefore, even for families who are indeed very willing to work, sometimes the increment is actually very little compared to the rising cost, and I think more families will be able to benefit now with the extension of the criteria.
While MSF is not able to say how many more people will be eligible for the scheme with the revised benchmark, about 96,000 people benefited from ComCare in the financial year ended March 2021.